Will I be in a lot of pain after surgery, and how is the pain managed? That's a really, really good question. And there's been, it's actually surprising that not a lot of people complain of significant pain after the first 24 hours from surgery. Usually, anesthesia, local anesthesia with lidocaine wears off somewhere between 4 to 6 hours, assuming that we've combined it with that epinephrine we mentioned. At that time, around 8 hours after surgery, the last time you've been treated with local anesthesia, one can expect peak pain. Now, peak pain is different for everybody, but it's not, it certainly is not any individual's threshold for maximum pain. Usually we get out of 6 out of 10 or 7 out of 10 in the worst cases. Most people are pleasantly surprised that, with appropriate dressing and pressure bandaging, that the evening of their surgery, they're in pretty good shape. But when we manage pain, we also think about, okay, well, we don't want someone to suffer. So what can we give someone in order to be comfortable? And there have been quite a number of studies now that have looked at skin surgery specifically, and Tylenol, ibuprofen, and Tylenol number 3, which is essentially Tylenol or acetaminophen, 300 milligrams combined with 30 milligrams of codeine. So that Tylenol number 3 is a controlled substance. It is in the opioid family of medications. But only 95% of the time do we, really lean on, or 5% of the time, I should say, 95% of the time, we don't lean on opioid medications. So it's a very rare circumstance that we do. And even when we compare head to head with acetaminophen, which is Tylenol, or ibuprofen, or other types of NSAID family medications like Aleve, we find that the combination every 2 hours of 1,000 milligrams of Tylenol and 400 milligrams of ibuprofen, alternated every 2 hours, is superior not only in managing immediate postoperative pain, but the durability of effect is also superior compared to Tylenol number 3, which is an opioid. And so that's great because there's, it's over-the-counter medication. It's readily accessible. It doesn't require a prescription, keeps people comfortable, and it also has less side effects related to the opioid family of medications and the addictive behavior that family has been associated with.